I think that so oftentimes that government entities, agencies, or for-profit, non-for-profit, oftentimes we see a need and we think that this is something that will be helpful to the community. And I guess the best lesson learned for me is that the community knows what they need. They know how they want to be delivered, and that they need to be a part of the process in planning and making things happen.
I think that, first of all, they need to think about who's in their community. They should look at some of their demographics that may exist in their community, whether large or small. There's always going to be people that may represent immigrant communities, that may represent different racial and ethnic communities. It's like people you see at the grocery store, people that you see that you purchase some of the goods or services that you have in your communities. Getting a sense of who those folks are, and then getting a sense of who are some of the community leaders for some of those communities. Like, do they go to a specific church? Do they go to a specific store? Do their children or do our family members, do they attend a specific school? Getting a sense of where do they congregate, where do they meet at? And then thinking about how that you can start building those relationships. It's not about starting new services or that you need to hire additional staff. It's about kind of looking at how to start those partnerships with people that represent these different cultural groups, and really thinking about how we can best meet the needs and serve those needs of that population.
For the tribal groups, and I'll focus in on that because that's where I come from. Some of it is cultural sensitivity, especially around sovereignty. Not a lot of people understand the personal meaning to that for tribal people, or the jurisdictional challenges that come along with that. At the same time, there's a lot of comparison with the rural culture in Wisconsin, especially up north, around some of the isolation, the lack of resources, the importance of personal relationships in really getting the work done. Sometimes those go beyond written protocols. If those are strong and developed, things can really happen. And yet, there's such a call to have something on paper, and a lot of times translating that to paper gets really difficult. So there becomes a cultural kind of shift from process or context focus to they want content, and sometimes it doesn't meld very well. And sometimes they can transition that well. And that's one of the things that we're looking to help them put in writing what they already are doing sometimes.
We listen to Latinas. We make the changes that we needed to make based on what we heard from Latinas. One of the things that we heard over and over is that they wanted to see our advocates in Casa de Esperanza more in the community. So one of the changes we did, it was to have advocates available in the community. So being available with women are. When women live in the houses and the school systems and the clinics and the hospitals and the churches. So one of my big advices is always listen. Listen and don't assume that you know what is best for your community. The community are the ones who know what they need and how they need it.
We had a program once a year over in different parts of the city. North Minneapolis was really noted as, really not a really good area, but I made sure that they knew who I was in North Minneapolis. They knew who I was in, and no matter what part of the city it was, is that you have to be a part of the community. You can't be sit in the office and think things are going to happen, because they won't.
The first thing that needs to be done when you're developing programs for gay, lesbian, bisexual, transgender people is you have to look at yourself. You have to look at your program. You have to go through it and, do you have gay, lesbian, bi, or trans folks? If not, why not? If you do, are they comfortable being out? Do they like the program? That sort of thing, Then you have to educate yourself about the communities, about what programs are out there. They might not be domestic violence, sexual assault programs, but that are working with LGBT folks, and particularly the elders. And once you've got kind of a handle on it, it's like meeting them, getting to know what they do and who they are and all that sort of thing. I think that's one of the really important things.
What do we say about access? What do we say about limited English-speaking persons? At what point do we identify that we might need to get an interpreter there? Did we have interpreter services available at that particular point in time? And if not, oftentimes we didn't have in some areas. What would we do? We focused on town hall meetings, asking those communities what would they need. Sometimes we talk in terms of cultural guides and helping us gain access into communities. That's not to ever mean that one person, I as an African American, there's no way that I represent my community, because I am what my life experience has been, and my life experiences grew up in East Texas, and my experience may be different than that of an African American in San Antonio, New York, or wherever. And so the whole work was about gaining access and then working with individuals to see how we could best serve them. And I think it boils down to respecting the differences and valuing the differences of others, and looking at your systems and what you're doing to provide a culturally comprehensive system of care.